I am Dr. Troy Alexander L. I am the post-acute medical director for IMMPACT. So it is my responsibility to make sure that the providers and the facilities have good communication with each other. Also, that the providers are providing excellent care to the patients and the communities that we're serving. IMMPACT has been one of the leaders in the Chicagoland for providing care in nursing facilities. So I was lucky enough to be introduced to the group and with the group an organization that has really led change in the skilled nursing world in the Chicagoland area. One of the things that we noticed was that the on-call coverage overnight, even though it was telehealth, they didn't know the patients. So they may send a patient out for a seizure, but a patient may have known seizure disorder and maybe just needed to get another medication or come back and check on them in 30 minutes. So we noticed that the return to hospitalization rate had increased. And one of the ideas that Dr. Zaman had was to create our own telehealth service. And so because we knew the patients, we were the medical directors, we were providing the primary care, he figured out a way to do it, and that's where Hucu came along. So some of the challenges with telehealth that I found is time. As the post-acute medical director, I reached out to all the facilities and tried to create a schedule between the facilities, the nurse practitioners, and the doctors, making sure that everyone knew when, or at least an average time and day, that the provider would be seeing patients virtually. And I think that's made it a lot easier, so the nurses don't feel like they're always being pulled to have to see patients. They have a set time and a schedule that they can abide by. Once we've done that, it's been really nice. It's flowed really easily. It's seamless. The nurses just reach out to I may be on one unit, and then the nurse reaches out to the next nurse once we're done, and then they come in to see with the patients virtually. And so it's created a good flow. Well, Hucu made it easy. So Hucu, because of the platform and using the video messaging that we have, in addition to text messaging, you can do video messaging. And so what the nurses will do, well, first what I do is I will say, I'm ready to see some patients. I will send a picture of my list of patients that I want to see. Because it's HIPAA compliant, I don't have to worry about just doing initials or first name, last initial. I can say the patient's full name. I can write it out so there's no confusion. If there's 3 Mr. Johnsons in the building, we don't have to wonder which one we're referring to. So having that HIPAA compliance is really nice. So I'll send my list. The nurses will take a look and sort of decide amongst themselves who will start. And then they just send messages to each other to say, we'll start the video, and then they'll send a message to the next nurse to say, like, we're done, we can move on. And, typically I can see 20, 30 patients very easily in that way, whereas it may have taken a lot longer if I was in person or trying to do it on another platform. When we first started with Hucu, we had both a group and a one-on-one training, so that we were able to customize the channels, the portals, everything that was in the Hucu app was able to be customized to what I needed and what I thought would be helpful. So we went through trainings with the different facilities, making sure that they were on board, that they understood how to use it. It took probably a month or so, a month or two maybe, to get all of the facilities, the providers, on board and up and running and actively using it, in the sense of, instead of calling to make a message on Hucu where the provider, and you can upload a picture of what you're asking about. You can mention the patient, upload it into their channel, and I can respond very quickly and give orders instead of making a phone call, leaving a page. I have to call back. Maybe I'll get somebody to pick up the phone if the nurse isn't busy, give the orders, hope that they transferred the orders correctly. But once we all sort of started implementing it, it was easy to see how helpful it was. So it was just a matter of getting started which, like I said, probably took about a month or so for everyone, myself, the facilities, to really get on board. It wasn't hard. Like with any app, I think there were some hiccups, but that's technology in general. So one of the awesome things about Hucu is that we were able to communicate those glitches or the concerns that we had and have changes almost immediately, so within a week or two. So now with Hucu, because it's HIPAA compliant, the staff can upload everything from the patient's chart, essentially. So any documents that came from the hospital, imaging labs, medications, it's all there in the app. And so I have a constant point of reference. And so that has made it very easy for myself as the primary provider, but also for the on-call. And so being able to have that paper trail and that chain to look back and say, okay, a month ago, this patient had pneumonia and they were started on this antibiotic. Now they have another pneumonia. We can start them on a similar antibiotic or do something differently. But not just that, but also really being able to say, why does this patient have pneumonia again, and have it not be just a one-off treatment and treatment for treatment's sake, but really being able to look at the patient as a whole person and identify what other concerns could be coming up that could potentially prevent another infection and also preventing hospitalization. One example that comes to mind is a facility that we were having some difficulties with communication and getting a scheduled time to view patients. So once we were able to get the schedule on board, I was able to round and see some patients, one of which was having some abdominal pain all day. The nurse who I was rounding with was able to speak with the floor nurse and find out that she had not urinated all day and was having some abdominal pain. Because the patient was demented, it was really difficult for her to communicate her pain and her discomfort in a way that if the provider and another nurse weren't there together, we may not have been able to find out exactly what was going on. So with us finding out that the patient hadn't urinated, was having abdominal discomfort, we were able to catheterize the patient, get over a liter of urine, and treat a urinary tract infection. And the awesome thing about that is we were able to prevent a hospitalization, provide the patient with some comfort, and really have good teamwork with myself, the nurse, and the aides working all together in a really short span of time. After the telehealth visit, I was able to provide the orders via text, make sure that the nurse practitioner or any other provider following up was able to see exactly what we did for the patient. And later on, when I usually follow up in a week or two, I was able to see how the patient was doing, follow the lab results. Everything was right there in the patient channel on the app, which made it very easy to follow up and not have to track people down to get the information that I needed. I do like the reporting to know which facilities are utilizing Hucu. We have noticed that the facilities that utilize Hucu more are usually have a lower return to hospital rate. We have found that the ones that are not using it as much have more communication errors. There's not as much follow through, and so the communication is lacking in general. That's why I encourage them to use the Hucu app, because it is a seamless thread of communication. So in a facility that has EHR, there's a patient who has a pneumonia. So he has pneumonia, and on the x-ray, it showed a pretty significant abnormality. And I went back into the patient's chart and noticed that from the hospital, there was a missed follow-up. And so by posting it in Hucu, I was able to alert several other people versus trying to do something via text, a group thread where you can't give patient-specific information. So in Hucu, I was able to upload the a picture of the document from the hospital record. I was able to take a picture of the new x-ray from the EHR and say, these are the things that need to be done. And then that way it flows a lot better because you can see everything in one location versus jumping from three different screens to try to see what's going on with the patient. Hucu is able to save me time, especially during overnight call. So if a call comes in at 2 o'clock in the morning, because I'm on call 24 hours during the work week, I am able to listen to the message and respond in the Hucu app without having to necessarily get out of my bed, go in another room, make a phone call, hope that the facility answers and that the nurse is not doing something else by the time I'm calling back. And so it has really been able to provide a more direct line of communication with the specific nurse and being able to answer their question in a timely fashion without playing telephone game that usually happens in the nursing facility. So for example, when a facility is ready to round, I can copy and paste my Zoom link and it goes into the thread. The nurses know exactly where to click. It comes directly to me on video. And once we're done with the visit, another nurse can go right in and click on that same link. So it's just seamless text to video transfer. Another feature, like I said, is the multimedia. So being able to upload both text, pictures, documents, all of that can be in the app, and you can scroll and see something from 2 months ago, 3 months ago, and really be able to follow up, especially for those facilities that do not have electronic medical records. My dream for the future is that the facilities that I work with will be able to understand the benefit of telehealth. In the past, calling a provider, faxing was the standard. There has to be a new way, and we have to adapt to new models. And Hucu having text, video, and photo upload applications, it makes it easy to have everything in one place. And so my goal is to have the facilities recognize that and recognize that it allows for the providers, the nursing, and all the staff to have a centralized location for everything.